Hey everyone, have you ever heard someone say, "Oh man, I really need to organize my desk. I'm so OCD today." Or maybe a friend is just having a rough afternoon and casually claims they're so depressed? Welcome. We tend to throw these clinical terms around all the time, right? Like they're just quirky personality traits or temporary moods. But the reality is far more complex, super fascinating, and honestly, incredibly important. In this explainer, we're going to separate the everyday myths from the actual biological facts and build a really solid foundational understanding of mental health.
Here is our quick roadmap for today. 1. Myths versus mental health. 2. Decoding depression and anxiety. 3. The truth about OCD. 4. Managing panic attacks. 5. The power of sleep. And finally, 6. Seeking clinical care. Let's just jump right in.
Section 1. Myths versus mental health.
Okay, let's dive into this, because before we even touch on treatments, we really have to look at the cultural barriers and the sheer global scale of mental health challenges that stop people from seeking help in the first place. Get this. According to World Health Organization statistics, over 56 million people in India alone suffer from depression. 56 million. And yet, there is this deep-rooted social stigma that completely prevents treatment. In so many cultures, conditions like depression are basically dismissed as a behavioral flaw, a lack of discipline, or just straight-up weakness. It's often attributed to personal failure, rather than being recognized as a genuine medical condition. And that fear of being judged as fundamentally flawed, it keeps millions of people suffering in absolute silence.
We really need to shatter the myth that seeking therapy is some sort of weakness or that it's only for people with a quote-unquote serious illness. In reality, therapy is literally like going to the gym for your brain. Through a biological process called neuronal plasticity, therapy actually helps your brain remold and shape entirely new neural pathways. You're not exposing a weakness at all, you are actively building resilience and expanding your brain's capacity to adapt to stress. How cool is that?
Moving on to Section 2, Decoding Depression and Anxiety.
Let's see how this builds into the actual clinical realities of these conditions and really separate them from normal everyday human emotions. Now, sadness is a universal emotion. We all feel it, it's temporary, and it's almost always linked to a specific trigger, like losing a job or failing an exam. But major depressive disorder, that is a persistent mood disorder. If feelings of emptiness, numbness, and a total loss of interest in your favorite hobbies last longer than 2 weeks and start disrupting your daily functioning, well, that crosses the clinical threshold. Just to give you an idea of the scale here, recently, 21 million adults in the US experienced a major depressive episode in a single year.
Furthermore, people so often confuse anxiety and depression, even though they can definitely happen together. Anxiety is deeply rooted in future fear. It's this intense anticipation of a threat that triggers very real physical symptoms. We're talking a racing heart, sweating, trembling. Depression, on the other hand, is deeply rooted right in the present moment. It is characterized by heavy despair, a complete lack of energy, and an overwhelming exhaustion that makes simply getting out of bed feel absolutely impossible.
All right, Section 3, the truth about OCD.
Now, what's really interesting here is how we tackle one of the most casually misused terms in our entire modern vocabulary, obsessive-compulsive disorder. It is incredibly common to confuse being highly organized with having OCD. And hey, it's completely valid to enjoy a tidy room or a perfectly color-coded spreadsheet. But true OCD is not a quirky personality trait, and it is definitely not a superpower of focus. It's a complex, exhausting biological condition characterized by highly distressing, intrusive thoughts. It's driven by severe anxiety, where people feel absolutely compelled to perform rituals just to neutralize that overwhelming, terrifying distress.
To truly shatter that neat freak stereotype, let's look at the 4 actual types of OCD. First up, contamination, which is the intense fear of germs or illness. Second, symmetry, that intense, burning need for things to feel balanced or, quote, just right. Third is checking. This is repeatedly checking locks or appliances because of a debilitating fear of causing catastrophic harm. And fourth, intrusive thoughts, sometimes called pure O, which involves distressing, unwanted taboo thoughts. Honestly, someone with OCD might actually be incredibly messy if their specific compulsions revolve entirely around checking locks or managing internal mental rituals.
So, the absolutely crucial point here is that while OCD symptoms can evolve and shift over a lifetime, the condition is highly treatable. The gold standard treatment is called ERP, or Exposure and Response Prevention. This is a specialized therapy where patients are gradually exposed to their anxiety triggers, but, and here's a key, they're guided to resist performing their compulsive rituals. By just sitting with that intense discomfort, the brain eventually learns that the imagined catastrophe, it isn't actually going to happen.
Section 4. Managing panic attacks.
Let's pivot into the real toolkit portion of this explainer. A panic attack happens when your body's fight, flight, or freeze response activates without any real threat actually being there. It's a terrifying misfire of your brain's internal alarm system. So here is your mental emergency toolkit. Step 1. Move your body. Your system is literally flooded with adrenaline, priming you to run. So go for a brisk walk to burn off that pent-up energy. Step 2. Progressive muscle relaxation. Clench your muscles as tight as you physically can, then release them, moving all the way from your toes up to your head. And step 3, cleansing breaths. When we panic, we tend to shallow breathe from our chests. Put a hand on your stomach, take a deep breath, and sigh out loud to really expand those constricted lungs.
Beyond those physical steps, experts actually recommend creating a literal mental first aid kit. Think of it as a small grab bag of sensory items to help ground you when severe emotional distress takes hold. The goal is to engage your 5 senses. Keep a little vial of soothing essential oil to smell, some strong mints to taste, a piece of velvet or a fidget toy to touch, photos of your favorite places to look at, and a go-to playlist of nature sounds or even your favorite stand-up routines to listen to. These strong sensory inputs essentially yank your brain out of its panic spiral and pull it right back into the present physical room.
Next up, Section 5. The power of sleep.
And this brilliantly illustrates our next major focus. Zooming out from acute panic, let's look at your daily, foundational habits. In one clinical study of people suffering from depression, a staggering 87% of patients experienced major symptom improvements simply by resolving their insomnia. 87%. Just let that sink in for a second. Getting enough quality sleep isn't just some nice little wellness bonus. A lack of sleep can literally mimic or cause mental illness, while fixing your sleep can actively heal your brain.
So how exactly do we get better sleep? Well, we use sleep hygiene to train our brains, exactly like Pavlov's dogs, to associate specific cues with sleep. First, limit your daytime naps to under 30 minutes. Second, cut the caffeine 4 to 6 hours before bed. Seriously, it stays in your system way longer than you think. Third, dim your screens and use night mode, because blue light biologically tricks your brain into thinking it's morning. And finally, reserve your bed strictly for sleep. Don't pay your bills or watch TV in bed, or your brain is going to associate the mattress with being alert and stressed.
Finally, Section 6. Seeking professional clinical care.
We've covered a ton of ground today, right? From recognizing symptoms to daily hygiene. But one of the absolute biggest hurdles to getting long-term professional help is simply knowing who you're supposed to see. So let's break it down. A clinical psychologist uses psychotherapy, like that cognitive behavioral therapy we discussed earlier, to help you navigate your thoughts and treat the actual root causes of your distress. A psychiatrist, on the other hand, is a medical doctor who can officially diagnose conditions and prescribe medication. And very often, they work together as a team. For instance, a psychiatrist might prescribe medication to stabilize a severe depressive crisis, which then makes the patient open and actually able to engage in therapy with a psychologist to tackle those root causes. Now, there is a huge, very common fear that prevents people from seeking a psychiatrist's help, and that's the worry that pills are going to somehow alter their personality. But the reality is this: medications aim to reduce your symptoms, not change who you fundamentally are. Psychiatric care is a highly individualized process of trial and error between you and your doctor to find the exact right balance. The goal is to clear the heavy fog of the illness, allowing your true self to actually emerge again.
Which brings us to our final provocative thought for today. What is one step you can take right now, today, to strengthen your mental fitness? Seriously, think about it. Whether it's setting up a solid wind-down routine for better sleep tonight, building a little sensory first aid kit for your car, or making that courageous phone call to book a therapy session, remember that your mental health is dynamic. Verbalizing your needs isn't a weakness. It is the vital, incredibly powerful first step to healing. Keep learning, keep focusing on your well-being, and I'll see you in the next explainer.